What is up, everybody? Welcome back to another video. If you're tuning into this video and you watched my last video, I appreciate you guys coming back. Welcome back again to my second vlog and story about my double jaw surgery. So today's video, I want to talk about double jaw surgery and what does that exactly mean? How is the procedure done? What are the implications of jaw surgery? What's the timeline look like in terms of recovery, prep, all that kind of stuff, and kind of what to expect in general with getting double jaw surgery. So before I go into all that, I just want to say that I've been researching this and going through this process now because I got my braces January 2018. So again, it's about 15 months, 16 months of having braces and learning about this, understanding it, reading it, talking to surgeons. But I'm no medical expert, right? I don't have a degree. I'm not a doctor, so take everything with a grain of salt. This is just what I've learned. Some of it, I can't, say for sure that all of it's 100% accurate. I assume it is, considering I've been told it by doctors. But I just want you to know that if you're going through this process, don't take everything that I'm saying to be true and that it's going to be exactly that way for you in terms of the recovery or whatever. Everybody's different. Everybody's mouth is different. So some things might not be the same. So that's out of the way. So double jaw surgery, what does that exactly mean? How does that exactly work? So for me, I'm gonna be having well, actually kind of like three things done. So again, if you saw it last video, my upper jaw is too narrow and undeveloped. So it's not closing over my bottom teeth. So what has to happen? I have to have my upper jaw broken and move forward to go over the bottom teeth, but at the same time, because that's happening and because my lower jaw is in the position it is for my current bite, they have to still also break my lower jaw and move that forward. So a lot of people are surprised by that because they go, oh, you have an underbite, your lower jaw is sticking too far forward, but how does that mean that you have to have surgery on your lower jaw, and why are they going to move it even further out? So it's a little bit interesting. Like for my lower jaw, it's actually in a pretty good position. It's kind of where it should be. Again, most of the problem is in the upper jaw, but when you change the upper jaw, and whether you slide it out and maybe you angle it a little bit down, or maybe you angle the bite a little bit up, you still have to change the bottom jaw. It's not like it can just fit to how my face is structured right now. It's crucial for the bottom to jaw to also kind of move forward a little bit and then angle up a little bit. So this jaw is going to be moved outward and angled up a little bit, and the top jaw is going to slide forward and maybe angle down a little bit, so that way it closes correctly. So a lot of people are surprised by that when I tell them that I'm having double jaw surgery and that both my jaws are going to be broken. They go, oh, why your lower jaw? Well, it looks like your chin is sticking out. It's already too far, so how are they moving that forward? That is the case. For my specific medical procedure, the upper jaw is called a Lefort 1 osteotomy multi-segment with bone grafting. And I'll talk about that in a minute. And then the bottom jaw procedure is called a Bi-Lateral Sagittal osteotomy, also with bone grafting. So the first one I mentioned, the Lefort 1 multi-segment, it's a little more complex. So I'm going to put some images on the screen right now. And I'll kind of walk you guys through it. So this is a picture of a skull, and as you can see, there's a line on the top jaw, and that's essentially where the cut's going to be. So it's way above your teeth and the roots, and it actually goes all the way very close to your septum and essentially through your nasal canals, and that's where they cut across. So the jaw procedure happens all the way from the right side to the left side, all the way, an incision all the way through here, all the way across. And it's right through the bone. So essentially my teeth are like just slide across. They can essentially just be pulled out. Well, I guess not really, because maybe there's some tissues and stuff holding them together, but they can pull out. And then the multi-segment part for my upper jaw means that I have to have a palate expansion. Like I mentioned again, it's too narrow, my upper jaw, so they need to have a palate expansion. And the way to do that is once they cut all the way across the top of my mouth, they're gonna also cut right here and split it down the middle. Now, they're not going right through my teeth, but they're gonna split it a little bit at the top so if this is my jaw, right? Imagine that there's two lines right here, and there's my teeth in the middle, right? Let's just say my fingers extend right through here. the incisions are going to be here and here. And what happens is the palate expansion happens from the inside out. So it goes like that. They're not going to pull apart my teeth like that. They're not going to do any other way. So they make the incision all the way across the top, and then there's also cuts right here and right here, and those are gonna open up like that, and that's gonna create the palate expansion. So that's the multi-segment part for the palate expansion, and that's how they do the top jaw. Procedure is pretty intense, as you can imagine. The prep work I've been doing right now for this procedure is about, again, 16 months of braces. It's taken a really long time. It's like a long journey from start to finish, for over 2.5 years, and the surgery itself takes about 6 hours, 5 to 6 hours personally for me. Some people it takes less, depends on what you're having. So that's the upper jaw. For the lower jaw, the surgery is done a little bit differently. They actually do like a zigzag type movement so that it's a slide mechanism. So as you can imagine, to get through a slide, you go through, you go over, and then you go down across. So it's like a Z. And then what happens is once they do that, they can slide the lower jaw out like this. I don't know how to show this, like that. So they can slide the lower jaw out and then angle it a little bit up. The lower jaw for me, luckily, only has to go out like a couple millimeters. I think it's like 2 millimeters, while the upper jaw has to go out much further. Maybe like, I think it's like 6 or something like that. I have all this paperwork here. About 6 millimeters. It's not that much, it's a decent amount, but the lower jaw is gonna move only like 2, which is like the size of the tip of like your pen. So what kind of recoveries am I looking at? What are the implications of a surgery like this? So it's invasive, obviously. It takes about 6 hours. They cut right through your nasal passage and your septum, like I said. A lot of the nerves are cut through and damaged. And primarily on your lower jaw is the biggest nerve, and this nerve down here running through your lower jaw. Even if you just touch it sometimes, if like it just poked, it's not torn or cut or anything like that, even if you just touch it, they're very, very sensitive, and it can make the nerve go in shock. And because of that, there's a risk and a potential for all double jaw surgery patients to lose feeling somewhere in their lower lip or lower face forever, permanently for life. And that might mean like a little tingling feeling. That might mean you just not feel it at all. Maybe it feels like a little bit of a cold patch somewhere on your lip. It's different for everybody. I think as a younger, patient, I hope this doesn't happen to me, but it's definitely a risk and something that I have to consider and just, deal with the facts on that. In terms of the upper jaw, the invasiveness is pretty serious as well. I lose feeling here in my face for about 6 months. So this part basically gets all cut through, right? They're cutting through the whole jaw, so all the nerves there just basically get cut. And over time, they're like a spider web. You're gonna feel some tingling here, what I've been told, and they're gonna be kind of stitching themselves back together. So you should regain feeling back here in your face, but that will, have no feeling for quite a long time. So once I have the double jaw surgery, what am I gonna look like? It's basically gonna change my appearance, obviously, right? It's my mouth. It's gonna be moving out, and it's gonna change the facial structure in terms of from here down, but also when you move your upper jaw forward, again, it's not just above your teeth, it's like really far up. It's like up here, right below your cheekbones, kind of. They really just like open up the skin. And by the way, this whole surgery is done in the mouth. There's no incisions on the face or anything like that. But I should get fuller here in the face. The top jaw will come out a little bit. This part should be fuller. Some surgeons recommend getting like a genioplasty, which is adjustment of the chin, sliding the chin back a little bit, the bone here at like a diagonal angle. And some also recommend getting like a cheek augmentation and putting some bone graft here or a putty that they can mold and make it look like how they want it to. Sometimes they also just screw something in here. But for me personally, I've talked to a couple different surgeons. One recommended this and 3 others didn't. It's also obviously, as you can imagine, more invasive. If you were to do this surgery, but also the chin and the cheek thing, your face is going to be really pissed off. The nerves are going to be screwed. You're going to be so swollen on top of what you're already going to be, and it just gets really intense. So with that being said, thank you for watching. I hope this video helped a little bit explain kind of what the procedure, how it's done, and kind of what to expect in terms of the recovery. I hope to take videos of my progress and recovery, and what I mean is even day one. So when I wake up in the hospital in my hospital gown and needles hooked up to me and tubes, stuff like that, and kind of track my progress as I hope to heal quickly, and kind of what the whole procedure and experience is going to be like. Thanks for watching. Like, comment, subscribe. I'll see you next video.